So what is the cornerstone in the management of patients?
So as I mentioned, this is the most problematic part is how to lower the uric level in the long run. And this has to rely on both effort of the patients as well as the physician in charge. And this comprises very drastic changes in the patient's lifestyle. So if a patient like to drink a beer or every now and then perhaps they should need to try to restrain the consumption of beer and also some of the shell food and also red meat. So this is the most problematic part to change a person's behavior. And then the second part is to try to convince the patients the importance of a good uric level management to prevent further attacks and to prevent further complications from happening.
So how important is it to treat patients to target?
By treating the patients to target, the target level, as I mentioned in different guidelines, actually it varies.
Yes.
But then the main essence is that we want to reduce the uric level to the level that the crystals start to decrystallize. So when a uric crystal form, usually they will form when the uric level is above a certain limit. For example, in SI unit, it will be like 360 micromole per liter, and then in other units, it will be 6 milligram per deciliter. Then, if the uric level is above that level, then the crystal will start to form. So on the reverse, when we try to treat a patient with gouty arthritis, we want the crystal to decrystallize, so to become more soluble and then going back to the bloodstream. So whenever we try to treat the patients, the target level is the level that we want the crystal to dissolve. So this is very important because otherwise, if the crystal is not dissolving, then it will continue to incite inflammations in the joints and the corresponding soft tissue. So you don't really have a good effect on your treatment. So treat to target is very important. And of course, when you lower the uric level, all the other comorbidities will also reduce. For example, the chances of producing, developing chronic renal failure, uric acid stone, and also further impairment of the cardiovascular system will also improve by treating the patient's uric level to the target.
So how would you convince your patients the importance to treat to target?
So I usually will tell them that gouty arthritis is not just a joint disease, it's a global disease involving all parts of the body, like patients with diabetes or hypertension. So we are asking the patients to control their blood pressure and their spot sugar to a certain level because the ultimate aim is to prevent cardiovascular comorbidities, for example, myocardial infarction or chronic kidney disease from happening. So by the same token, I will usually ask our patients the importance of treat to target is to prevent further comorbidities from developing, such as prevention of joint damages and chronic deformities, and also prevention of chronic kidney disease, and also prevention of other cardiovascular comorbidities. So by that, then the patients usually will be more aware that this is more than just the joint. It's more a whole body disease.